So welcome again to today's webinar. My name is Layla Moomin and I am the Community Engagement Coordinator with the Canadian Cancer Survivor Network. So thank you for attending the webinar entitled Cancer Still Waiting, Impact of COVID-19 on Cancer Patients and Their Ability to Receive Treatment Wave 2. We are pleased to welcome our presenter, Marjut Huotari. Marjut has a bachelor's and a master's of business administration from the Schulich School of Business, York University. She is a marketing professional with over 20 years experience working with the pharmaceutical industry, including 14 years working on the client side. With Leger, Marjut manages both qualitative and quantitative market research, conducting research with a variety of healthcare practitioners and patients. With her team, she aims to help her clients to understand the issues and help develop solutions. As many of you know, in May to June 2020, the Canadian Cancer Survivor Network commissioned Leger to conduct a national survey to evaluate the impact that COVID-19 has had on cancer patients, survivors, pre-diagnosis patients, and caregivers. The results of our first survey revealed that the pandemic response triggered another public health crisis, the postponement and cancellation of essential cancer tests, procedures, and treatments. We then decided to commission Leger for a second survey in December to evaluate the impact that the suspension of cancer services during the first wave is currently having on those who have been affected by cancer. At the end of the presentation, our speaker will be able to answer your questions. However, at any time during the webinar, please feel free to type questions into the window on your screen. For those of you who have not attended an earlier webinar, the Canadian Cancer Survivor Network is an organization working with cancer patients and survivors to learn about health system complexities, connect with others to plan action, and act to promote best care and healthier survivorship. If you'd like to learn more about CCSN, please visit our website at survivornet.ca. This webinar is being recorded, and it will be available tomorrow on YouTube. In addition, the slides will be available on SlideShare. Links to both will be sent to the email you provided. Now I will turn things over to our presenter. Welcome.
Thank you so much, Layla. It's a pleasure to be presenting you wave 2 of this study for you. And right now, for just in case, because everyone's working from home, as you can see from my background, that I'm going to turn off my webcam just to make sure that we have bandwidth here as well. So today I'm going to talk to you about wave 2 of this research study that we've conducted for CCSN. And ideally, we were hoping that we wouldn't have to do a wave 2 and we wouldn't have to worry about these results, but we're here to tell you and present these results to you now. So really today I'm going to look at the research context and objectives, what we're doing, how we did the research, where we did recruitment, the key findings, conclusions, and then we'll open it up to a question and answer session for everyone. So as we've already heard, Leger on behalf of CCSN conducted a second wave of the study to really assess the extent to which the disruption of cancer care caused by COVID-19 impacts cancer patients and caregivers from both an emotional and physical wellness perspective. We wanted to really look at the key topics we wanted to incorporate were: have appointments been canceled or rescheduled? Are for treatments, for surgeries, what's happening with appointments? Have there been delays in diagnosis? For example, are patients waiting for their tests to confirm a diagnosis for those who are in pre-diagnosis stage? Have there been changes in treatment? Have they been switched from doing IV therapy to oral therapy, from in-hospital to in-home, for example? Have patients avoided going to the ER for symptom related to their cancer diagnosis? What has been the emotional and mental impact of diagnosis and treatment delays? How are patients and caregivers interacting with doctors managing their cancer? Are there virtual consults? Are they doing it electronically by phone or in person? What's been happening? How do they rate the quality of care during COVID-19 that they've had? So these are new questions we added from the first wave. And continuing to look at, has clinical trial participation been affected or been put on hold because of COVID-19? So in this study, we actually went to a larger sample size this wave versus last wave. We went to just over 1,600 Canadians, including almost 1,200 Canadians actually diagnosed with cancer, almost 250 caregivers of patients diagnosed with cancer, and up to just almost 200 Canadians who are in that pre-diagnosis stage trying to determine if they do or do not have cancer. The study was available in both English and French. Data collection for the study was in December from the 3rd to the 29th. And as you can see, the first wave was done from May to June, and we went to a total sample size of just over 1,200. So we went to a bit larger sample this wave, and we can see here on the next on this that we got really good regional representation. Ontario, Quebec, as always, represent the bulk of the population presented because that's the bulk of the population in Canada. But also we have good representation from BC, Alberta, the Atlantic region, Manitoba, and Saskatchewan, giving a Canadian perspective on this study. For the recruitment, we used our LEAL panel, which is our proprietary consumer panel, the largest in Canada to recruit everyone for the study. And our screening criteria were the patients and caregivers had to be 18 or older and currently living in Canada. A patient was enrolled if they were diagnosed with cancer. A caregiver was recruited if they were currently living family member or someone they care for was diagnosed with cancer. It could be a friend they help take care of. And pre-diagnosis if they are currently in the process of trying to determine if they have cancer or to rule out cancer. And we were trying to keep those in remission up to a maximum of 35%. So what did we do? What are the key study findings here? Just as a prelude to what we're going to go over. We do see that the restrictions put in place to manage the COVID-19 crisis continue to have considerable disruption to many aspects of cancer care in Canada. We saw that despite consulting doctors using virtual modes of interactions, we have seen delays in appointments and treatments, and that has had a major impact on patients and their caregivers. And among those who've had in-person appointments and scheduled procedures or surgeries canceled or postponed, it has taken on average a month, 34 days to reschedule the appointment, and about a month and a half to reschedule the procedure or surgery. And as we saw before, the first wave, the many disruptions to cancer care continue to take a mental and emotional toll on patients and caregivers. And the concerns about receiving adequate cancer care both during and after COVID-19 fuel anxieties. What we've seen here is that the anxiety levels are now back to what it was during the height of the first wave of the pandemic. So anxiety concern has risen again to the early days of the pandemic. So who did we talk to? If you look at those patients that we spoke to, we had a really good even split of males and females. Of patients, you can see good regional representation across Canada. In terms of age, this wave versus last wave would tend to skew slightly older. Last wave, the average age was 59, now it was 66. And numbers and brackets are previous waves, so if you see those there. And we still had a good mix of location by population, good mix of town, cities, urban, metro, and rural. As we saw last wave, prostate cancer represent the largest portions of the patients that we talked to, and also about 1 in 10 patients included colorectal, melanoma, skin, lung, and bladder cancers as well. In terms of what stage of cancer patients were, we saw that about a quarter were in stage 1, 11% stage 2, 8% stage 3, another 8% stage 4 metastatic, and remission slightly higher than we were looking for at 38%. And we had 1 in 10 who said they were not sure of what stage of their cancer they were at. And how long has it been since they were diagnosed? It varies greatly among patients, but a majority, about 2/3, were diagnosed in the past 5 years, so earlier stages versus last wave. In terms of the caregivers that we spoke to, slight skew towards females as we saw in the first wave. Again, good regional representation across Canada. Again, in terms of age, we had a good mix of ages, and again, same as last wave, 47 years of age was the average age of the caregivers we spoke to. And we also had a good mix of locations by population for the caregivers. And the most common cancer types being presented were breast, lung, prostate, and colorectal, similar to what we saw last wave. And again, in terms of what stage the patient they're looking after was at, stage 1, 14%, stage 2, 20%, stage 3, 13%, stage 4 metastatic, almost a quarter, and remission, 20%. Who did we talk to? What was the relationship for most? You can see that a lot of people that participated were either the spouse partner, 1 in 5, daughter or daughter-in-law, 14%, mother or mother-in-law, 15%, father or father-in-law, 8%. So good mix of relationships that we had overall. And also a time since diagnosis does vary, but again skews towards more recently diagnosed, with 6 in 10 diagnosed within the past year. In terms of the pre-diagnosis profile, we again see here that there's a slight skew towards males overall. The majority are from Quebec, followed by Ontario here for the pre-diagnosis stage, but still good representation across the country. Skews younger, similar with 65% under 55, with the average age being 48 versus 46 last wave. And here we tend to skew towards the city and metro areas, with most 47% city, town, 33% urban metro, and 1 in 5 in the rural areas. And as they're waiting for their possible diagnosis of cancer, we see that just over half have actually discussed signs and symptoms with their family doctor. Just under half have been referred for further investigative testings, and 14% have been referred to a specialist for further investigation. So that gives you an idea of who we spoke to in the cancer patients, their caregivers, and those who are in that pre-diagnosis stage. Now let's look at the results of the study. We can see we're looking first at the experience with appointments during COVID-19. We can see, and in here, the first number you'll see is 55% on the left, and in brackets you'll see versus wave one. So it's very similar numbers to what we saw in wave one in terms of how many had appointments canceled or postponed or rescheduled. We're seeing here again that caregivers and pre-diagnosis do report more appointments canceled, postponed, or rescheduled versus patients. We see that 14% have avoided going to an ER, more so among those caregivers and pre-diagnosis patients again. 13% have had surgeries, procedures canceled, again, more so with those caregivers and pre-diagnosis versus the patients. And we look at patients and caregivers. These are new questions we added this wave. 18% have had a lab diagnostic test canceled or rescheduled, and 10% have avoided visiting a hospital for cancer care, more so among the caregivers. So really see that there continues to be appointments canceled, postponed, or rescheduled. And when we look at some specifics of different patient types, you can see that appointments canceled, postponed, or rescheduled really hits more those who have been recently diagnosed or in that metastatic stage, as we see also with those avoiding and visiting an ER. In terms of having surgeries, procedures canceled, it was more those patients in the adjuvant setting, also reflected with the caregivers there as well. And what's been their experience with treatment during COVID-19? We can see here that a couple of new things we added this way. We can see that 13% have had a change made to the treatment or mode of administration of treatment, significantly more so for caregivers versus patients. 10% have been receiving treatment at home instead of in a healthcare facility, also more so among caregivers. And 7% have experienced delays in starting continuing treatment versus 11% in wave one. And we see that there's been a significant drop for those patients in starting continuing treatment. So there more have started treatment this wave versus last wave. But again, when we look at a change for mode of administration, we see that the bigger change for patients have been with those who are recently diagnosed or in the metastatic stage, and delays in starting treatment more so for caregivers in the adjuvant stage. So we do see a slight decrease in patients experiencing delays in starting continuing treatment. However, 22% of metastatic stage and 37% of caregivers report change in their treatment protocol. As we also see here in terms of clinical trials were impacted, we do see that enrollment in clinical trials have slightly gone down versus last wave. 5% versus 11% report being enrolled in or being considered for a clinical trial this wave. So that's not a good thing if there are less people going into clinical trials. And 2 in 10, about patients who were enrolled in or in the process of being enrolled in a clinical trial, report the clinical trial being put on hold or stopped altogether, with close to 4 in 10 recently diagnosed patients reporting a clinical trial being put on hold or stopped altogether. So we have less people saying clinical trials were impacted, but there are still challenges in getting enrolled in clinical trials. What's the average time taken to reschedule appointment? This is a new series of questions we added for wave 2. And we saw that from a patient perspective, 38 days for a time taken to reschedule appointment. Caregivers and pre-diagnosis, both 27 days. So it takes about a month overall, an average of every 134 days to have an appointment rescheduled. But we also saw that about 36% say that they've not had an rescheduled appointment time yet. So we can see 36% of patients, a third of caregivers, and 40% of pre-diagnosis have said that they have not had their appointment rescheduled yet. And in terms of how long it takes to reschedule a procedure or surgery, You can see it takes a lot longer to have a procedure or surgery rescheduled, 61 days for patients and 44 days for caregivers, and pre-diagnosis 41 days. So really, on average, it's taken 52 days to reschedule a procedure or surgery. But we also see that almost half say, 46% of the respondents say that no appointment has been time has been set yet. Just almost 40% for patients, 45% for caregivers, and looking at pre-diagnosis, 61% said no rescheduled appointment time yet. So those are people who don't know what they have yet. So uncertainty is prime there. So overall, of those who've had in-person appointments and scheduled procedures, surgeries canceled or postponed, over a third claim that they have yet to have appointments rescheduled, and nearly half are yet to have procedures, surgeries rescheduled. So very concerning from a patient, caregiver, and pre-diagnosis patient perspective. And we also asked again this wave, what are your main reasons for avoiding booking an appointment with a doctor? Overall, as you can see across the board, concern, fear of COVID cases, too many COVID cases is across the board for all as their main fear. As you can see from these quotes, I don't want to be in contact with too many people to avoid getting the COVID-19. Outbreak of COVID at the hospital. COVID-19 is a higher priority and my doctors put me on hold. Concerns for patients, they don't want to get COVID. Also, some talk about the fact that the doctors are not taking appointments. It's hard to get a hold of their doctors, and they're too anxious, afraid, or stressed or sick to go for an appointment. And what is the impact of having appointments postponed, treatments delayed? Really, you can see here that 72% report it's having an impact on their health. 69% of patients, 83% of caregivers, and 71% of pre-diagnosis patients. It's had a major impact on their mental and emotional health, with many highlighting being anxious, stressed, and worried and concerned. As you can see by the quotes here from a patient, daily stress, actually minute by minute stress, as it just never goes away. Plus, it's seriously affecting my spouse. It's not impacting only the patient, but those around them. From a caregiver perspective, added stress, anxiety, and worry. Empathy for their pain and suffering also makes it hard to plan your life. Always just kind of on standby. The worry coming through there. And in terms of pre-diagnosis, stress for me and my loved one, created tension with my spouse leading to arguments. So that whole mental toll of not knowing what your diagnosis is, knowing what's happening, getting those appointments postponed or treatments delayed is really having an impact. So overall, COVID-19 concern continues to be the main barrier for avoiding, or is the main barrier for avoiding booking an appointment with your doctor. Appointments being canceled or postponed continue to affect all, with 72% of those who experience delays reporting a major impact on their mental and emotional health. So as we see here, there has been and continues to be a major impact of COVID-19 on patients, caregivers, and pre-diagnosis patients. And what are the main concerns following during COVID-19? What you'll see here on the left is the arrow up shows it's a significant increase versus the previous wave, which is in brackets. So what we're seeing is that overall, 63% versus 56% wave one are concerned about their ability to receive hospital care if needed. A further 63%, again versus 63%, are concerned about their ability to be cared for in an ER if needed. 62% versus 51% are concerned about being able to receive cancer treatment in a timely fashion. 59% are concerned about receiving in-person care, and this is a new attribute we added this wave. 59% versus 54% are concerned about being able to get tests related to cancer. 56% are concerned about being able to get help for side effects related to treatments or new symptoms. And again, 55% are concerned about being able to see doctors managing their cancer for follow-ups. The one thing we'll see here is that patients overall are slightly less concerned versus the caregivers and pre-diagnosis, but those numbers for the first three for patients, receiving hospital care, getting cared for in the ER, and receiving cancer treatment in a timely fashion, their concerns here have actually increased this wave versus last wave, as has the caregivers worry about being able to receive cancer treatment in a timely fashion and the pre-diagnosis. So those are more significant. And when we look at specifically some cancer types, we can see that ability to be cared for in the ER impacts those in the metastatic stage more so. Being able to receive cancer treatment in a timely fashion impacts recently diagnosed more so. And receiving in-person care impacts the adjuvant stage more so. And those being able to see doctors managing cancer for follow-ups is recently diagnosed impacts them more so. So overall, we do see that patients are significantly more concerned about receiving care in hospital, ER, if needed, and receiving cancer treatment in a timely manner compared to after the first wave of COVID-19. And now this chart we looked at last wave is similar to what we saw last wave. Prior to COVID-19, you can see levels of concern with patients, caregivers, and pre-diagnosis. Patients in red, caregivers in blue, pre-diagnosis in green. And as we saw here, that patients always were lower than the caregivers and pre-diagnosis, with pre-diagnosis only 26% concern prior to COVID-19 versus 49% of pre-diagnosis and 63% of caregivers. During the height, you can see that everyone's concern levels increased. It really increased overall significantly for everyone. Almost 50% of patients during COVID-19, during the first wave of COVID-19, 73% of pre-diagnosis and 79% of caregivers. When restrictions started to relax and ease, you can see that the numbers came down. They weren't as worried, but they were still more worried than they were prior to COVID-19. But now, as we did the survey in December, when we asked again, you can see that those concern levels increased right back up to the same levels as before, almost before. So that we are seeing that anxiety levels among everyone is really increased during the height of the first wave. Specifically, 5 in 10 patients report currently being very or somewhat anxious, the most anxious being those with metastatic cancer, those who were recently diagnosed, those diagnosed with lung cancer, and female patients. 3/4 of caregivers said that they were anxious, and nearly 3/4 of those pre-diagnosed with cancer say they feel very or somewhat anxious during the second wave of COVID-19. This rises slightly over 8 in 10 among females pre-diagnosed with cancer. So we really do see that with appointments being canceled, postponed, and concerns around receiving hospital ER care and timely treatment, anxiety levels are back to what they were during the height of the first wave of the pandemic. Also, this way we looked at healthcare providers and how they interacted with during COVID-19. We can see here the good news is that there was more interaction with healthcare providers during COVID-19 during the second wave. You see patients had more interaction with their specialists, their family doctors, and caregivers reported more interaction with all specialists, doctors, pharmacists, and allied healthcare professionals. So we see significant increases, and also in terms of others, recently diagnosed patients are more likely to say they interacted with their GP and specialists more so this wave, and metastatic stage patients report increased interaction with their specialists this wave. So we do see that's a good news that they're actually seeing doctors more so. And among those who interacted with each of their physicians, we can see that virtual, either telephone, video, email, etc., was the main source of mode of interaction during the pandemic. And overall, if you look at the satisfaction levels, you can see that from a patient perspective, they were 91% satisfied with virtual, caregivers 80% with their GPs, 82% with their specialists in terms of virtual, and the pre-diagnosis 77% satisfied with the virtual with their GP, 87% with their specialist. So really see some changes there. And in terms of in-person, you really see that those numbers actually increased versus last wave significantly. So that was good. So doctors were starting to see their patients again overall. So we saw an increase in in-person interaction this wave, and we are seeing that there's good satisfaction overall as well. So compared to last wave, we do see significant increases in interactions with physicians, especially in-person interactions, but we do see that majority continue to have virtual interactions more so than in-person consultations. And how satisfied have they been with the quality of cancer care received during COVID-19? Overall, we can see that 54% say they're very satisfied. If you look at these charts, it's the solid color at the top. So for 54% overall, with 61% of patients saying they were very satisfied. Lower for caregivers and pre-diagnosis. Caregivers at 39%, pre-diagnosis at 31%. Well, 20% overall are somewhat satisfied, and 11% are somewhat unsatisfied, not at all satisfied. And why are they not satisfied overall in terms of being somewhat unsatisfied or not at all satisfied? The key reasons why are delays in getting care, the fact that the doctors aren't available, the appointments have been canceled, the status of appointments, treatments unknown, and having to deal with doctors over the phone. So even though they're okay with the phone, they're still not the interactions they want and need. And what have been their top concerns about receiving care during COVID-19? So about half of those surveyed highlighted access to healthcare as their main concern about receiving care during this diagnosis. So access to healthcare, you can see that 51% of patients, 57% of caregivers, and half of the pre-diagnosis patients said this, with those in the patients in the metastatic stage much more likely, more concerned about this access to healthcare. And fear of getting COVID is the second most stated concern with across the board. And in terms of pre-diagnosis, the one that really stands out there is, as well as caregivers, is delays and long waits overall. So with this, we see that with increased in-person consultations, just over half say they're very satisfied with the quality of cancer care received during the pandemic. Concerns around access to healthcare and delays in getting care drive dissatisfaction with quality of cancer care. And once the COVID-19 restrictions are lifted, what are the main concerns there? We can see here that 37% are concerned about being able to receive hospital care if needed. 36% are concerned about being able to be cared for in the ER. 30% are concerned about being able to receive cancer treatment in a timely fashion. 30% are concerned about coverage and funding of new treatments. 32% are concerned about receiving in-person care. 31% are concerned about being able to get tests related to cancer. 28% are concerned about the availability of new treatments. 23% are concerned about being able to get help for side effects related to treatment or new symptoms. And 28% overall are concerned about being able to see doctors managing their cancer for follow-ups. When we look at the three categories of patients, caregivers, and pre-diagnosis patients, you see that overall cancer patients themselves rate their concern level lower than those who are taking care of somebody with cancer or those who are waiting to understand what they have, as we saw before. However, in terms of patients, you can see that metastatic stage patients are more concerned about getting to the ER if needed. Adjuvant stage are more concerned about able to receive cancer treatment in a timely fashion. And those recently diagnosed are more afraid about coverage and funding of new treatments. In terms of caregivers, getting hospital care and the ER needs are more concerning for those caregivers with metastatic stage, as well as availability of new treatments for patients in the metastatic stage. So there's concerns overall and also more specifically. So we really see that 59% they are likely to remain concerned about receiving adequate health care even when COVID-19 restrictions are lifted after the second wave. So major concerns still going on. What are the effects of COVID-19 on the following aspects of life? We can see here that, as we can see here, 53% versus 56% in wave one express fears for the future. The good news is less patients this wave express fears for the future, but you see that caregivers and pre-diagnosis continue to be more concerned. 53% versus 55% wave one have increased levels of anxiety, and this has increased more so for the caregivers overall. And there's a directional increase in 49% versus 43%, the fear that the cancer will progress, specifically more so among caregivers this wave for the patients they were caring about. And 45% versus 44% wave one state has affected their overall state of health and well-being, more so again for the caregivers versus last wave. But when we look at those in different stages of cancer, you can see across the board from a patient, those who are recently diagnosed or metastatic stage are more concerned, express more fears for the future, have increased levels of anxiety, are more concerned that their cancer will progress, and also feel that the overall state of health is being affected because of their cancer. So if you're recently diagnosed or in metastatic stage versus just other patients, you are expressing more concern of it's impacting their life. So those who are pre-diagnosed and with cancer, recently diagnosed, and those in the metastatic stage continue to worry more about the future, and nearly half, slightly up from last wave, fear that their cancer will progress. So we do see fears and worries are still out there, and more so in some patients. So what did we find overall? Cancer patients, caregivers, and those pre-diagnosed with cancer continue to face challenges with doctor's appointments, with 55% reporting cancer care appointments being canceled, postponed, or rescheduled. 3/4 of metastatic stage patients and 6 in 10 pre-diagnosis diagnosed with cancer and recently diagnosed patients report having appointments canceled, postponed, or rescheduled. Among those who've had in-person appointments and scheduled procedures, surgeries canceled or postponed, it took on average 34 days, just over a month, to reschedule the appointment, and an average of 52 days to reschedule the procedure or surgery, so a month and a half. Moreover, we also found that just over a third say they don't have a rescheduled appointment time yet, and almost half say they don't have a rescheduled procedure surgery time yet. Delays in appointments and treatments continue to affect all, with 72% reporting the delays having a major impact on their mental and emotional health. Patients are significantly more concerned this wave about receiving care in hospital ER if needed and receiving cancer treatment in a timely fashion. Appointments being canceled, postponed, and concerns around receiving adequate cancer care have fueled anxieties, with level of anxiety back to what it was during the height of the first wave of the pandemic. And among those who interacted with physicians during the pandemic, there was a significant increase in in-person interactions reported, which is a good thing. But there's also a significant number of virtual appointments going on, mostly telephone appointments. For all, access to healthcare, including healthcare practitioners, treatments, tests, etc., continues to be a leading concern about receiving care during the pandemic. The good news is that just over half were satisfied with the quality of cancer care they received during the pandemic, but that means that many were still not satisfied, and they were not satisfied mainly due to delays in getting care, doctors not being available, canceling appointments, the unknown status of their treatments appointments, and having to deal with their doctors over the phone versus in person. People still prefer that in-person interaction with their physicians. And finally, challenges still exist, as 6 in 10 express concerns about receiving adequate health care even when COVID-19 restrictions are lifted. Fear of cancer progressing has gone up slightly this wave. So there continues to be challenges overall. So thank you for listening to me talk, and now we can open it up to questions if there's any questions out there. Layla?
Yes, we have a number of questions in the chat. So
Okay.
first question, is the data on treatment and appointment delays publicly available, and have you stratified delays by cancer type?
In the report will be made available through CCSN. They have the report, and they will be publishing this information. The full report is up to CCSN if they will be releasing that. That is their property now. In terms of, we did look at some things by different cancer types, so it's not fully. I don't think we have it fully outlined in the report. With we did look at some of the main ones, but not all cancer types.
Next question. So regarding the rescheduled appointments and surgeries, are these statistics the number of days from initial date to the rescheduled date, or just the length of time to get it rebooked?
It is what the patients looked at, and I need to look at the actual question to answer that. So let me open the questionnaire. What was it? I'm going to stop sharing though. How do I stop sharing it? Am I sharing that questionnaire?
Sorry, you lagged for a bit there. Could you repeat what you just said?
What was the question again?
So the question was about the rescheduled appointments and surgeries. So were those statistics the number of days from initial date to rescheduled date, or the length of time just to get it rebooked?
I would have to, I'm looking up here. So we just asked, have they been rescheduled, but we didn't ask specifically. So it was I think it's the interpretation of the patient in the question. And
Thank you. Next question, can you speak to any areas in Canada that are doing better than others when it comes to delays in care?
I don't have that data. It is part of the report, so we did look at that by region, but at this point in time, I can't answer that directly right now. It is being shared with the CCSN, and they could provide that information later.
Okay, next question. Are caregivers' responses based on their own medical needs or the needs of the cancer patient they are taking care of?
We were asking them to talk in terms of the cancer patients they were taking care of, not on their own needs.
So related to that question, so why was there such a big discrepancy between caregivers and patients when you were talking earlier about rescheduled appointments and those delays?
We noticed that that's how they've answered it. That my speculation would be that we know it's the greater concern overall. I can't say why they were why it was different from patients versus caregivers. It could be their perception as well. So they're answering based on their perception and what they've seen. So I don't know why they answered that way.
Next question. So do you have data on who drove the decision to make changes in appointments? So were they physician-led decisions or patient-led?
I think they were a mixture of both. There may be data in the full report on that, but I don't have it handy right now.
Okay. Next question. So somebody asked if you could describe the caregiver category a little bit more.
Caregivers, what we looked at in terms of a definition for caregivers is we said when first question was someone I care for, it's a family member who was diagnosed with cancer, or someone I care for who is not a family member was diagnosed with cancer. And so those we're looking for those who it was a family member, somebody they're looking after as caregivers.
Next question, could you highlight one or two trends in the data that you found particularly troubling?
I think the level of anxiety going back up to those first levels is really troubling for me. The fact that you are waiting such a long time to get an appointment rescheduled, and appointment rescheduled or procedure rescheduled, and the fact that a lot of them are still, like almost half said they haven't had a procedure rescheduled. I think for me, those are very concerning facts there.
Thank you. Next question, could you speak a little bit more about how the COVID-19 has impacted clinical trials for cancer patients?
I think what I've read from other sources as well is other people have said the clinical trials are being impacted. People are running less clinical trials based on different research I've read recently as well. But I think what we're seeing here is that patients, last wave we had 4 and 10 patients. Let me go back to that page. Or this way we had 5% say they were enrolled in clinical trials versus 11% last wave. So for me, that looks like there's a trend that maybe it could be, this is speculation on my part, not from the data, that there could be actually less clinical trials going on out there. So there's less ability to have patients going into clinical trials. And this is my own personal perspective, not based on just on the research here. So I think that there's the fact that we're seeing less being in 5% only being enrolled versus 11%. It's not a big drop, but it is a drop in my mind with everything else I'm reading about in the marketplace, saying that there's potentially less clinical trials being run in Canada as well for different factors. So I think the concern for me is that if they're not running clinical trials, if we're not having access to clinical trials, it's a big impact on the overall industry in Canada for clinical trials.
Next question. So regarding virtual care, so it was mentioned that most virtual appointments were by telephone. Do we have a breakdown for what percentage of patients use the different modes for virtual care?
It is in the full report that we have, but I would say it's significantly more telephone versus virtual care. I think it was like 80% were telephone versus like 5 to 10%, and it's much. I don't have the actual numbers right in front of me, but it was significantly more telephone versus any other methodology. So it is really a phone call that they're having versus a video conference call.
Thank you. Next question. Has there ever been a situation that caused the same or similar delays in care? And do we have data around the health outcomes associated with the delays? Are outcomes of the COVID-19 delays consistent with outcomes expected from delays of other causes?
I don't have that information, so I can't really answer that question properly.
No worries. Okay, next question. So does the report speak at all about the ability of cancer patients to access prescription drugs or other forms of treatment that would be administered outside of hospital settings?
We did ask them about access to medication as well. So in terms of the overall, we asked them about their, we focus more on the cancer, but it's not just medication in the hospital, but we also talked about their access to medication overall. Anything else?
Yes, we do have a few more just coming in right now. Does Leger have any international data on the topic of cancer care disruptions due to COVID? If so, how does Canada compare?
I don't think we have any international data. I know there's more international data out, like different companies have done things like this. I know we also did a study, a syndicated report that we provided to looking at the impact of COVID on anyone with any chronic condition as well. So that if anybody is interested, they could reach out to us to get some information about impact of COVID on patients with chronic conditions, looking at also at medication use and things like that. So that's something that's separate, but it's not versus international.
Next question. Since caregivers responded on behalf of the patient's experience, was there a control in place to make sure there were not two responses to the survey from the same household?
Because I'd have to answer that. I'd have to look into that. But I think there would be some control because we were using the Leo panel, but I would have to look into that specifically.
Perfect. Next question. What were the biggest changes that you noticed between this survey and the last survey regarding pre-diagnosis patients?
Pre-diagnosis patients, the concern level, we noticed that, what was I saying? Pre-diagnosis patients really, we still see the level of concern. It's the fact that what we really notice with the pre-diagnosis patients is that there's a lot of people in that pre-diagnosis group who really continue to be fearful, continue to have the same challenges. There's, in terms of what improved, I think those are the main. I think it continues to be the same level of anxiety and stress overall from a pre-diagnosis patients that we saw.
Thank you. Next question. How did metastatic patients find any additional challenges or challenges that sort of stood out in comparison to other groups?
We highlighted some of those things in here about the metastatic patients already, so those are in the report so people can look at them. Anything else?
Just scrolling through, I think there's a couple more that are just coming in right now.
Yeah.
So this might have been addressed earlier, but someone was wondering if you could go over this again. So did you notice differences in terms of satisfaction with in-person care that people received?
We didn't ask specific. I don't think we have that looking at their satisfaction with in-person care. That wasn't a question we asked.
So I think those are all the questions that we have at the moment. I'll still give a little bit of time if people have additional questions that they're thinking of right now. But in the meantime, what would you say are a few main takeaways from this study that could possibly inform future responses from the government in terms of how to manage cancer care during pandemics?
I think as we've already talked about, the fact that people are the worry, the stress of people with COVID, the fear of COVID continues to be there. They want to be able to go to a place where they don't, if they have to go into the hospital, they want to make sure they go to a place where they don't have to worry about getting COVID. So making sure there's places in play for cancer patients, maybe something that's specific for them that they could look at to go where they could be almost clear of COVID would be nice. But I think the fact that you have these patients who are waiting, they're concerned, pre-diagnosis, those who are in early stages, those who are in metastatic stages, there's a lot of concern and fear out there. They want to be able to be treated, get the treatment they need when they need it, and not have delays. Other stats that we saw out there in the summer saying that more patients are now being diagnosed with later stages of cancer versus before because of the delay. I think those things and this study combined really highlight the fact that cancer can't wait. You can't put these patients on hold. You have to treat them at the time that they come in and treat them effectively to make sure that we are catching them at that early stage.
Just another question about clinical trials again. So someone asked, wouldn't clinical trials be more risky during a pandemic?
That would be a question for somebody who's an expert on clinical trials, but I could speculate, but it's not my area of expertise.
Okay. So just as a follow-up to some of those insights that you just provided to us, so what are some next steps that maybe people should take right now in terms of how to resume their care effectively?
I think from a patient, caregiver, and pre-diagnosis patient perspective, you have to you can't be as fearful. You are fearful, but you have to go for your treatment. Follow up with your doctors, get in front of your doctors, either telephone or personal. I think you can't bury yourself in a hole and say it'll go over because your cancer is not going to stop even if you stop. I think it's got to be make sure that you continue to interact with your healthcare professionals, get your treatment as required. As we saw, we did see an increase in patients going back to seeing their doctor, either face-to-face or virtual in the second wave of the study. So I think that's important. Continue to, from a patient perspective, continue to go out there and get your treatment, and don't not get your treatment.
Mhm. Absolutely. And that relates back to the New Normal Same Cancer initiative that CCSN has been a part of, really encouraging people to make sure that you are getting your treatments. And it's important to remember that in some cases, especially if the healthcare system has to deal with other issues as well, it's important to remember to continuously advocate for yourself and your own treatment. And if there are delays and if your treatments are being postponed, to take as much initiative as you can to make sure that you're able to get back in a timely manner. So making sure that you're prioritizing yourself in that way. So I think that's all that we have for questions today. So we'll move on to some concluding remarks for the presentation. So thank you again, everybody, for joining us for today's webinar. And thank you again to Marjout for going over these study results with us. As we mentioned, we will be sharing the slide deck with everybody. So if you wanted to take a closer and more in-depth look at some of the statistics that we were able to pull out, you'll definitely be able to do that as well. And you'll also receive a recording of the presentation in case there was anything that you wanted to go over again. So we have more webinars scheduled for 2021. Our next webinar will be taking place on February 18th. This webinar will be hosted by Ryan Clark, and it will be about healthcare in Canada. So it'll be a great follow-up and very timely considering the launch of this new COVID study to make sure that people are able to interact with the healthcare system and going over some of the intricacies of it to make sure people have the knowledge to be able to advocate for themselves effectively. So thank you again, everybody, for joining us today, and take care.
Thank you.